very much. And I was tuned in right from the beginning, and then obviously had to cut off when I got on campus here to get down. And I've listened with interest to what everybody has to say, and I thank you for your submissions. This is a really important subject. Also the contributions that have gone before me from the committee members. It is very clearly established that once-off funding on a yearly basis is just not working. It's not cutting the ice. It might make for good political announcements, but it certainly isn't where we need to be or what we need to be doing. So I want to try and tease out from here today what exactly we need to do. So first of all, have we quantified the situation in terms of how many clinical psychologists we need within the third level system? Maybe that's the first question.
Just to say that there's a range of psychological support. So it is clinical counselling psychologists, some educational psychologists also, but also psychotherapists who are, you know, really
And have we quantified
also.
what we need of each of them across the third level sector?
Do we know how many
Yes.
we need? Oh, well, I would
Yeah, the International Accreditation of Counselling Services recommend a full-time equivalent ratio of one counselling therapist psychologist per 1,000 students.
1,000.
So we have a benchmark for it, but I know we don't have the data to be able to see how far we are from that benchmark. I think once we have that data, then we need to be engaging with government to say, okay, here's what the shortfall are. What's the plan in terms of getting to reach that piece? So we know what's recommended. We don't know what we currently have.
Yeah.
But we also, as the concerns would be that even if we knew how many we needed, where are we going to get the staff to fill those gaps?
Yeah, so the first thing we do need is obviously we need more data, and we need then to have tied up to see what the extent of the problem is, because we know what's happening. We know because young people ring us up in the middle of the night as politicians. They shouldn't be ringing us up to ask us for clinical help and all of that. And we also know that we see from the Patients Association report, even yesterday from the HSE report, that many people are presenting, and many of these are young people who are presenting at A&E. They get fed up waiting hours and hours, and they just leave. And that is a very, very dangerous situation for us to be in, as well as it compounding the problems that are in A&E. So we have to quantify the problem, and then we have to look at that we don't have enough. So if we were to be engaging what we need to engage, I just want to look in terms of PSI. The sponsor pays 60% of the course fee, and the student pays 40% in the case of the clinical psychologist. What are the terms and conditions associated with that sponsorship? Is there any public service requirement in it, or could they possibly immigrate or move to the private sector on completion of the studies? So maybe just that short question.
To my understanding is there's no obligatory piece in terms of them having to continue in the public service as there are plentiful jobs, because there are not enough graduates coming through. In my experience, many do stay within the HSE and continue within the HSE. But we have a limited pool. So as I mentioned in my submission, in mental health alone, they estimated over 300 are needed for mental health. That doesn't take into account the prison service, the Higher Education Authority, TUSLA. But also, as well as that, the private practice people, there isn't enough of them. You can't ring somebody up now and get an appointment to see someone privately, because it's the same pool of people. Right. So there are terms and conditions with that. But within our counselling educational psychologists, they're not employees. They have no rights. They get no pay. They pay $40,000 over a 3-year course of it. And when the piece comes of, do you want to come and work for a system that has asked you to work for free for 3 years and pay $40,000 for the privilege of it? Do I want to work for you? Many will choose no, and to be honest, you can't really blame them.
No, you can't, or you can't stand over. You can't stand over that, and I suppose that feeds into the precarious working conditions across the third level sector. But certainly, no, we can't ask people to do it free, and that was indeed my next question. So you asked them to undertake 300 hours of unpaid work in the course of their studies. How would that compare with the number of working hours for a clinical psychologist? I'm just trying to get a sense of how closely they compare.
They're very, very similar. There's slightly different metrics about the number of hours that are required, but overall the same amount of experience is required from the HSC criteria to work within the service. So as a senior clinical psychologist, I will often have a counselling trainee or clinical or educational with me. They do the same work. They provide the same public service. One gets paid, two don't.
Yeah.
But the equivalence of what they deliver to young people on the ground in terms of mental health is equivalent,
Yes.
but they're not treated with equivalency.
Yes, yeah, exactly. I wonder what their mental health is like, their own mental health, when they're treated like that.
It's poor. I know many who have added money onto mortgages for their houses, many who
Yeah.
work part-time jobs at the weekends, as well as their studies, as well as their direct work. Some manage to get through it at a cost, both financially and physically.
Right. Yeah, sorry, Tricia.
I just wonder if I could add, because psychotherapists have a 4-year training, so it costs about the same, about 40,000 also to get through that with the same number of clinical hours, and they have never had any sponsorship for any of it.
Yeah.
So all psychotherapists pay for themselves.
Yeah.
And I'd like to say that the clinical and counselling psychologists all work in the student counselling services with us, and without them we would be really stuck.
Yes.
Yeah.
What has the response been from the Minister and the Department so far in terms of reducing the barriers for counselling and educational trainee psychologists?
Silence. We've had ministers basically pass the buck. One says you need to contact the minister, you contact that minister, you need to talk to somebody else. Eventually we got back to Minister Donnelly, whose response was his diary was full. We also wrote to the Taoiseach about the fact that each minister has said it's not my responsibility. So far nobody has taken responsibility, and the Taoiseach's response was thank you for your correspondence. So literally for 3 years of engagement on this and highlighting this issue, we've had no direct engagement with government about it.
And therein the problem lies, and it's quite shocking. So as you said, I think it was said earlier around the lip service that's played with, we all care, we all deeply care about the mental health of young people. And we don't do what we need to do, even the very simple things that we need to do to fix the problem.
And one of the big concerns we have is about the socio-economic profile of the people who are getting into psychology.
Yes.
So we have a lot of people from disadvantaged backgrounds, from ethnic minorities, who at the prospect of 3 years of paying 40,000 and working for free,
Yes.
it's just not possible, so they don't enter it. So we have a very diverse population now. We need to make sure our workforce actually represents that.
Yes.
But that is not possible to pay 40,000 for over a 3-year period.
No. And all of these things can, there's solutions to all of these things. I think that's the thing, we're not talking about sending somebody to some outer planet. There are solutions to every single one of these things, very pragmatic solutions.
So for 1 year of a cohort of counselling and education psychology trainees, 1.5 million.
Yes.
Would cover 1 year. Now, obviously, of course, that would be 4.5 for the full 3 years.
Yeah.
But in the context of how much we spend, this is
Yeah.
a very straightforward solution to this. But unfortunately, we need engagement to make that happen.
Yeah. So how are we going to cope with the influx of, and the welcome influx of Ukrainian third-level students who many of them will need intensive supports from the traumatic experience that they've had? How are we going to cope with that?
I'm going to allow only one response because you've run out of time. So if you want to direct that to one individual, we'll take that.
I don't mind whoever's best placed, I suppose, to open it, and maybe we get a chance to come in with a couple of more
Student
questions toward
counselling,
the end.
maybe, I think, yeah. Maybe Trish.
Yeah, the colleges have already been preparing for that, so there have been, certainly in Trinity Global, have been corralling loads and loads of people. We're looking at the psychology department who've offered their students to help. But it's going to take a lot of resources because I don't think the short-term model is going to work for very traumatised students. So we're going to have to change that and find some funding someplace to support it.
And we are looking at, as a committee, doing a special model in relation to the impact on education, both on primary, secondary and on third level. So we will have an opportunity to take a look at that. So thank you. Thank you, Deputy.